Hello, this is Reverend Dr. Anthusa Helena, owner and developer of Soullight. Soullight's mission being for healing and conscious awakening. I offer private individual sessions as well as integrative medicine programs. These programs are geared towards healthcare professionals that are interested in building and going beyond the scope of their regular professional consumer's license so that you can treat the entire being in a holistic medical approach as opposed to just treating symptoms and then therefore going to the core root of the problem to help initiate a more speedy and complete healing process, both for you and your client. Now, this is also programs for anyone else that's interested in integrative medicine and general wellness for themselves, maybe their loved ones or friends, maybe they're also caretaking someone in their family or a close friend. So anything dealing with modalities of healing and then personal growth and conscious awakening is of the utmost importance in integrative medicine and healing. So we choose a different topic lately per week to focus on. And there are many that are already on the YouTube channel. That's Soullight, Sollite, Anthusa Helena. And you can check them out throughout various social media modalities such as Twitter, Facebook, LinkedIn, as well as the YouTube channel. Today's topic will be a little bit briefer, but it is an introduction to the general integrative medicine programs that I teach, because we want to look at the person holistically on the physical, energetic, soul level, the spiritual level, and whatever psycho-emotional component that may also be operating within their system, but also on the soul level within the ancestral lineage, the culture, mass consciousness, the environment that we live in, and the everyday stressors that come our way. Not to say as well the chronic stressors that lead into more challenging areas of post-traumatic stress disorder. So today's topic is religion, spirituality, and medicine. Patients want to be seen and treated as whole persons, not as diseases. A whole person is someone whose being has physical, emotional, and spiritual dimensions. In this article, I use spirituality and religion interchangeably, since the vast majority of Americans do not make distinctions between these two concepts, although many do. Many seriously ill patients use religious beliefs to cope with their illnesses. Religious involvement is a widespread practice that predicts successful coping with physical illness. More than 850 studies have now examined the relationship between religious involvement and various aspects of mental health. An additional 350 studies have examined religious involvement and health in general. If a distressed and scared patient asks for a prayer, such a prayer could bring comfort. The comfort conveyed when a physician supports the core that gives the patient's life meaning and hope is what many patients miss in their encounters with their caregivers. There is increasing interest among the general public and the medical community in the role of religion in medicine. Most people believe in the healing power of prayer and the capacity of faith to aid in the recovery from disease. The National Institute for Healthcare Research, a privately funded nonprofit advocacy organization, has published extensive literature reviews suggesting that religious faith and practice are positively associated with health status. In addition, the National Institute on Aging and Harvard Medical School sponsor meetings on the integration of spirituality and medical practice. A survey of physicians states that there is hope that the wall between medicine and religion will be torn down. Nearly 30 U.S. medical schools now offer courses on religion, spirituality, and health. Assessing the spirituality of patients and providing spiritual care requires skill and at least an implied covenant between the provider and the recipient of such care. Although physicians are not trained to engage in in-depth conversations with their patients about their spiritual concerns, such discussions are not the sole domain of the physician, but many healthcare facilities have employed professionals who are trained specifically in this area, such as chaplains, pastoral psychologists, or mental health counselors with expertise in spiritual counseling and multicultural denominations. Thus, patients who seek spiritual support can be appropriately referred to these professionals. So that's just a brief article I had written a while back with backed up research to show you that the hospitals and wellness centers and more of the healthcare professions are being opened to including spirituality / religion and medicine as a holistic approach to their patients, because research and data is showing that it is something that is wanted and needed and asked for by the patients and our society at present at large. So, if you're interested in studying more with integrative medicine, looking at the holistic approach, medically backed, because all of my trainings have been done with world renowned medical doctors who therefore have certified me to also train you in return. So, with that said, if any of this resonates with you or some of my past YouTube podcasts that you might have watched, log on to www.sollite.com for more information and details about private individual sessions and integrative medicine programs. I hope you've enjoyed this topic today, and I wish you, as always, many blessings of health, wealth, and prosperity come to you and your loved ones. Have a most wonderful day. Thank you very much. Bye for now.